everyone. I'm Dr. Pratibha Singh, Chairperson of International Academic Exchange Committee, Fogsi, and I'm delighted to welcome you all for this 165th episode of Gyan Pravah series, which beautifully captures our purpose, the flow of knowledge. And if you see, it's not a number, it's a celebration of shared wisdom, thought-provoking conversation, and Foxy's unwavering dedication to academic excellence and cross borders and specialty. So, if you see, every episode is a step towards empowering minds and enriching women's healthcare. And today, we explore a subject that literally gives life, that is, organ donation and transplantation. So, let me begin with a thought that life isn't worth living until you find someone to die for. And the greatest gift you can offer is a gift of life. And it is very true that there is life after death, and you can give yours by choosing to become an organ donor. So, yes, we are talking about organ donation and transplantation. And it is my absolute pleasure and privilege to welcome a remarkably personality whose name is becoming synonymous with excellence in the field of multi-organ transplantation. India's one of the most promising transplant surgeon, Dr. Vishali Patil.
Thank you so much.
She's transforming lives with skill, dedication, and vision. And we are truly honored to have you, Dr. Vishali, at this podcast today. So welcome. And while our President Foxy, Dr. Sunita Tandulwadkar, Madam, is unable to join today because of her prior commitments, so I'm very grateful that our dynamic Vice President of Foxy, Dr. Komal Chauhan, is there. So thank you, Dr. Komal, for gracing this podcast. And now it's my privilege to introduce Dr. Komal. She, as we all know, she is the Vice President of Foxy 2025. She is also the Governing Council member of ICOG. And she was also the Joint Organizing Secretary of very successful AICOG, which was held in Mumbai this year in the January. And she has previously served as a chairperson of Foxy Medical Disorder Committee from year 2019 to 22. And she has several key positions in sister organizations like MOGS, ISOPARS, Mumbai Menopause Society, and many more. She is also the recipient of numerous awards and accolades for her outstanding contributions. And she is the medical director of Chauhan Nursing Home, and as well as a senior consultant, DNB teacher, and unit head at VN Desai Hospital, Mumbai. So with this, I request Dr. Komal to kindly bless our podcast. So over to you, Dr. Komal.
Yes. So today, on this day, I think a beautiful topic which Dr. Pratibha has thought of, and we have none other than Vishali Patil here. So this Gyan Pravah podcast series are doing really good. This is a Foxy initiative for this year, presidential year of Dr. Sunita Tandulwadkar for 2025. And every day we have this one-to-one, heart-to-heart connect podcast. And it's every day, so it's telecast every day. And all the gynecologists all over India are glued, and they are very eagerly waiting for the variety of topics, and we get that first-hand information from the key opinion leader, from the person who has vast experience in that subject. About Foxy, we are doing a lot of work apart from this podcast. There are a lot of initiatives which are there. The Sampurna initiative, the academic things, the CME, the conferences, everything is going on. Know your numbers. There are so many Foxy projects, and I think it is a real phenomenal work which is going on, and it is going on in a crazy speed. And when we talk about sharing knowledge, I think that becomes our first priority and motto. And so regarding organ transplant, yes, patients who develop organ transplant, so many mothers who become very sick during, there are two aspects to it, that they land up into some organ failure, while they are having pregnancy, complicated by a high risk pregnancy, admitted in the ICU. Renal failure is very, very common. And then we deliver and they go for dialysis, and later on they have to continue. they really want to complete their childbearing. It is not always that after a renal failure or something, they will stop and then they have that, or probably this outcome of pregnancy is also not very great because of the high risk nature. So the further entire reproductive career becomes really compromised. And when the transplant has now given them the hope, hope to become mothers, hope to live normally in their perimenopausal, menopausal age. So today's topic is going to be an eye opener to all the obstetrician and gynecologists who have these challenging cases who come to their OPD. So many doubts come into our mind, and we want to open that compartment of our mind to the patients and welcome them and treat them efficiently who undergo transplant. So over to you, Dr. Pratibha and Dr. Vrishali. Pratibha is doing the great job as a chairperson of the International Academic Exchange Committee. And this academic exchange is happening internationally also. So Pratibha will be going to have this dialogue connect with Dr. Vrishali Patil. And I will also be listening to you from the viewers link, because the show is, and the spotlight is only going to be on both of you. So thank you so much. Over to you, Pratibha and Dr. Vrishali Patil.
Thank you, Dr. Komal, for such wonderful words, and thank you for joining and sparing your valuable time. And now it's my honor to introduce Dr. Vishali Patil, one of the India's most promising multi-organ transplant surgeon, performing both adult and pediatric transplant as well as living and disease donor transplant. She has remarkable achievement to her credit, being a specialist in virtually all types of organ transplant. That is wonderful, including liver, intestinal, multivisceral, simultaneous pancreas and kidney transplant, islet cell transplant, total laparoscopic donor nephrectomy, single port laparoscopic donor nephrectomy, and complex hepatobiliary and pancreatic surgeries. She is also the certified fellow in organ transplantation from Henry Ford Hospital and the University of Wisconsin Transplant Center from US. And she has a distinction of having performed the first pancreas transplant and the first simultaneous pancreas and kidney transplant in the state of Maharashtra. That must have been a proud moment for you, Dr. Vrishali. And she serves on numerous transplant boards at both zonal and national levels. And she is also the joint secretary of Zonal Transplant Tissue Organization. She is also the specialist expert for National Health Authority and the Government of India. She is also an esteemed teaching faculty member for transplant surgery, training fellows, resident, both undergraduate and postgraduate students in the field of organ transplantation. Additionally, she is also involved in advocating for organ donation and designing educational programs for hospitals and intensive care units, promoting organ donor advocacy, and contributing to the formulation of organ allocation policy guidelines. She has published and presented numerous papers in reputed international and national journals, contributed chapters, edited several authoritative books on transplantation, and has many research articles to her credit. She is also most sought after invited faculty at various national and international conferences, and to her academic qualification includes MRCS from UK and fellowship in multiple organ transplant from US, and she is also the fellow of American College of Surgeons. Currently, she is the head of multi-organ transplant department at Dr. D.Y. Patil Hospital, Pune, and she also serves as a faculty teacher for core skill training courses in laparoscopy for surgeons at Royal College of Surgeons, England, UK. She has this surgical expertise among all types of organ transplants and complex abdominal surgeries, including those for renal cancers and vascular repairs. She has, for this exceptional contribution, she has been recognized by numerous awards and accolades, which include Devdut Award for her work in transplantation, Dr. Anandi Bai Joshi Smriti Puraskar, Veera and Sira for her service in organ donation and transplantation by Rotary, and many more like that. So if you see her CV, it is really studded with impressive achievements, and I could go on and on. But I will conclude with just one final statement that Dr. Vishali Patil is not only an outstanding transplant surgeon, but she is also passionately committed to spreading health and fitness awareness and conducting interactive workshops for patients and families of post transplant. So we are really proud of you, Dr. Vishali. And now I request you to please share a few words for this podcast before we finally start our conversation. So over to you, Dr. Vishali.
Dr. Singh, that was such a warm and kind and generous introduction. I think that's must have been one of the most elaborate introduction. I don't think this is just a part of journey which all doctors, I think you have and Dr. Chavan has had. So there's so much more to achieve and so much more work to be done. Thank you again for having me. I'm deeply honored to be here. At the same time, I'm really impressed by two, three things. One is that being at in an institution like Fogsi and in your work, but you have gone cross borders to discuss different aspects of different fields and then have conduct this kind of academic activities for team members of the Fogsi all across the country. So you're uniting everybody by a theme and going across the diversity and getting everybody together. I wish our surgical members also could think about it. I might steal your idea and work along the line, but I'm so honored and impressed by your work. So Dr. Chauhan and Dr. Singh, thank you. Thank you very much for having me. And I hope that I will be able to contribute valuably to your podcast, and let's see how it goes.
Yeah. Thank you, Dr. Vishali, and thank you, Dr. Komal. And now we will start our conversation. So my first question to you, Dr. Vishali, is that I have my topic was like, if you can converse with your organ. So if your organ could speak, what do you think a transplanted organ will tell to a new host?
I thought that was a very interesting and a creative question. I have never been asked this, but I'm sure if an organ was given a voice, it would say that you take care of me and I'll take care of you.
Yeah.
So I always tell my patients that once the organ comes into your body, it's like a marriage. You have to work towards keeping it a success. And if you work towards it, if you take care of your organs, then the organs will definitely take care of you and your life would be successful and can lead a healthy and a good life.
Yeah.
So आप मेरे ख्याल रखो, मैं आपका ख्याल रखूंगा.
Yes, definitely, because this is, I think, the second life she's getting or he's getting.
Sure.
So I think they have to take care of that. And that is what I think everybody should understand. But still we say that many people fear that there will be an organ rejection. Like once any organ fails, and when we talk about this transplantation, they say, "Arey, saab, ye to kahan success hota hai?" So what do you think, what can be the cause of this organ rejection or not success, being successful?
See, God has made our body, or our human bodies are such intricately designed that we have our own defense system. जो कि if there are any foreign invaders, be it infection, be it a foreign object or injury or tissue or cancer, we have the ability to fight them. We have our white blood cells in which there are T cells and B cells, as you all know, and our defense immune mechanisms which can fight that. So similarly, when a foreign organ comes into our body, whether it's your mother's organ, your sister's organ, your siblings, or anybody's organ, it's still a foreign thing for our body. So rejection could happen, can happen anytime. And for that, we have medications which can suppress this rejection. So taking the medications regularly, ensuring that you maintain a good healthy lifestyle, I think that reduces the chances of rejection. रिजेक्शन से डरते रहेंगे तो फिर जिंदगी का मजा ही नहीं जी पाएंगे.
Yes, definitely.
So I think knowing, having that information, keeping a regular checks, people can lead a very good and healthy life. My own uncle had a kidney transplant when he was 35 years old, and now he's 83 years old.
Oh God.
So people can have a very healthy and a good life if you maintain your rejection and immune mechanism very well.
Yeah. Because today this podcast, actually not only doctors are listening, there are many non-doctors are also involved in this, and they are also listening. So I want them to understand that why why you should fear so much, because now a lot of advancement has been done. So what do you think? What is the role of immunosuppressive? I think drugs which you are talking is, I think, immunosuppressive drugs which
Correct.
should be given.
Yes.
Uh,
So, immune
and what are the risks for that? Like if you start continuing with that drugs, is there any risk of continuing it?
See, immunosuppression is important for transplantation as of now. We haven't yet developed a system where once you put the organ inside, our body accepts it and then there is no rejection. Our defense system is so strong that we have the ability to reject, or it's like an allergic reaction, right? If there's anything foreign comes in, our body reacts to it in an allergic manner. So our immune mechanism, defense mechanism can fight that. Now, just because rejection can occur, there's no need to worry because there are medications which can prevent rejection. Medications which can treat rejections, whether it occurs in the acute phase, that is early on, or whether it occurs after some time also. So there are lots of medications, new medications available which can detect early, or even treat late and help a person lead a better and stable life. So are there any risks with the medication? Like with any medication that we take, a painkiller can cause gastritis, cancer drug can cause hair fall. Similarly, rejection medications have their own risks that can come along with it. But compared to the advantage that they have, the risks are very minimal, which can be preventable or controllable. So I wouldn't want people to fear about the risks with the immunosuppressive medications. There are sometimes people can have kind of loose motions or gastritis, or sometimes the most important risks that we all fear as transplant doctors and transplant physicians is the risk of infection. Because if your defense system goes down, then you're unable to fight against the infections that are there in the community, right? Like malaria, TB, COVID, pneumonia. So these can come to you easily. But one can combat that by leading a healthy lifestyle, avoiding risk areas, avoiding risk behaviors. And that is what we counsel all our patients on a regular basis. So having done that, or if they catch an infection, coming on early and then they're able to fight it, one can do and lead a healthy life. Just last 3 months ago, we had a young man. I say a young man because he's 83 years old. And we did a liver transplant for him. He was doing well. And then he had a nose infection, a fungal infection, which would have been like a really worrisome. But he got treated early and now he's free and he lives in Bihar, leading a healthy life. So I think it's the way you can early detect it and go to your doctor, get treated. And if possible, if you can prevent infections, you can lead a healthy lifestyle by doing that.
I think you have to be tuned with your doctor and you have to understand what is lifestyle change you have to do after transplant.
So true. And when you compare the risk of death to be able to enjoy life, when you compare life and death, you'll always choose life, right? With whatever risks that it comes with.
Yes, definitely. Very nicely explained, madam. Now, I want to ask you, how does the organ matching process works? Like, how do you think that this organ will match to this patient? Or, I mean, this is many times we have seen that even in the family, that organ gets rejected.
So, Dr. Singh, I must really appreciate you because you're asking some of the very key questions. I go to so many interviews, radio, TV, and even magazine podcasts. These are important things which people don't ask. And these are important queries which people must be having in their mind. See, organ matching occurs at different levels. One is definitely blood group matching. We look at. Previously, we would look at, for example, A blood group organ would go to only A type. O would go to any of the types. AB will have to go to AB type. But nowadays, we even look at AB across blood groups and then by doing special tests. So one is blood group matching. Second is size matching. Third is, so sometimes if the recipient or the patient needs a transplant is a very thin person. And for example, if it's a liver coming from a very big 100 kg man, that liver is going to be too big for this young person or young lady. Similarly, if it is a lady who needs a kidney transplant and the donor is say a 12-year-old child, so or a 1-year-old child, should we do that or should we consider giving that organ to a pediatric child? So size match. Third is a tissue match. There are special tissues, tissue typing methods that we do. That is T cell cross match, HLA cross match. So immunologic matching has to be done for specific organs like kidney and lungs. So we look at all these kind of specific methods. Urgency, priority match. So children are a priority over adults anywhere for any organ. People who need two organs are a priority over a single organ because the risk of dying is more. Children are unable to live longer with the end organ failure. They succumb very quickly, they get sick very quickly, therefore, they become priority. So, somebody who's in acute failure becomes a priority for a chronic failure, like acute liver failure, acute somebody who's in heart lung failure, who's on pump and is very critical, becomes on super urgent list. So as a transplant faculties, we look at different points and then decide who will benefit from this organ the most, who needs the organ the most, and depending on that point, we do the matching.
Very correctly you have told. You were talking about the children. I mean, they match more. So what do you think about the pregnant lady? Like if a pregnant lady, you need to, or a female who is who want to bear child after transplantation, is it a possibility of doing that?
So
and how do you think in that way? What all precautions? I mean, if one patient comes to me, which you have done, I mean, in childhood, she has been transplanted and then she becomes pregnant.
Oh, yes.
So how are we going to look after that patient? Because she's going to come to me as a gynecologist or as an obstetrician, I'll be looking after her. So what all precautions I have to tell her and what all precautions she should take?
So whenever a patient comes who's been transplanted in the past, is on immunosuppressive medication, if she comes early on, say that I would like to be pregnant, then we definitely ask them to undergo detailed evaluation by the gynecologist to see how her uterus is, if there's any problem. Secondly, we lower the immunosuppression. Some medications can impact cell division in the babies. So we might lower them depending on how her health is. So first is we look at if she's fit enough to have pregnancy.
Yeah.
And sometimes taking a hasty decision can risk the organ failure. Okay. So therefore we tell them that they really have to be at least 1 to 2 years after the transplant that they can conceive. Okay. Because first 2 years the medications are at a very high level. And they might bring about some changes in the fetus that might lead to some other disorders or malformations or malignancies, which you don't want. You want a healthy baby and a healthy mother. So we usually ask them to wait for 1 to 2 years, preferably 3 years, depending on how they feel. Usually I've seen after 6 months to 8 months, they feel strong. They're like, ma'am, when can I be pregnant? We would like to have a baby. So usually after 1 to 2 years is a safe time that they can conceive. Once they conceive, then there are some calcineurin inhibitors or mycophenolate mofetil which help in cell proliferation, which stop cell proliferation. So we might have to bring down or tone down the strength of the drugs so that they do not impact the baby more. And then we might ask some neonatal tests or fetal tests to be done more frequently to identify any problems with the fetus very early on. And we might have to switch them on steroids in the initial first trimester. Then later on they might have. So depending on each patient is special. Depending on how the pregnancy is progressing, we might have to make such changes.
So, I mean, for the transplant patient, any patient, how long this drugs will continue? It will continue lifelong
so lifelong. So currently lifelong immunosuppression is advised, but the number of medications and the strength of medication does go down really very minimal. So first 5 years, they might be on good strength of medication. After 5 years, it really comes down to 50% of the strength. Okay. You might go from 3 drugs to only 1 drug. You might come down from half the strength and gradually over 8 to 10 years, and you might be only on 1 drug or no drug also. Nowadays, we taper off the steroids even in first month. So there are new protocols coming in, new medications coming in, which are more safer and which can be taken without any risks further.
Wonderful, wonderful. So thank you, Dr. Vaishali. And next, I want to ask, what is the difference between living and the deceased organ donation?
So,
how it is different and what is good? Disease or?
See, living donation is when your nearest relative or a friend who's willing to donate a part of their body. It could be a part, like one kidney, part of the liver, and can donate to you. And that can be for transplant. That's useful only for liver and kidneys. For heart and lungs,
liver and kidney.
Yes, we do not have lung donation yet in our country. So as of now in our country, heart and lung, I mean heart of course has to be from deceased donation. A pancreas has to be deceased donation. One can donate a part of intestine for intestinal transplant. So there are only particular organs that can come with living donation.
Okay.
With deceased donation, one can donate heart, lungs, liver, kidneys, pancreas, intestine, so different organ, even hand, limbs can be transplanted, corneas, of course, can be
Okay.
transplanted. Now, in terms of the patient outcomes, when compared after 5 years, the outcomes for living donor transplant and deceased donor transplants are more or less the same.
Okay.
So it is both are beneficial. The most important benefit is in the acute phase when disease donation is unpredictable. There are thousands and thousands waiting for transplant, and if you are in the queue, you don't know when the number comes. For example, the waiting time for kidney transplant is 4 to 5 years, and in some states it's 6 to 8 years. In northern states where donation has not picked up so much, it could be even 10 years.
Yeah.
While the waiting time for liver is about 3 years, but liver failure sometimes does not even withstand 6 to 8 months.
Yeah.
Patients succumb to it. So 60% of patients die waiting for an organ.
Yeah, we
This
have
is
seen such patients.
correct.
They were waiting, and they could not.
They can't, and whether it's younger or older doesn't matter.
Yeah, it's a
Whether it's
big-
disastrous, it's fatal. But living donation, you can plan, you can do it when the patient is healthy, willing for transplant, optimized well. And you all know, like we all work together as surgeons when we operate. A well optimized patient means a good
Yeah.
outcome. They can go home quickly and less complication. The more they are waiting, the more sicker they become, the risks are more.
Yeah, definitely. And what about the organ? How long this organ can survive outside the body? Like if
Until a few years ago, the organs we were transporting organs only in ice boxes like coolers, where
yeah,
the temperature was less than 4 degrees Celsius. So at that time, the kidney would survive for about 10 to 12 hours or maximum 16 hours, liver for about 8 to 10 hours, and heart only 4 to 6 hours. But now we have different machine perfusion pumps which maintain temperature sub-zero, but at the same time keep on perfusing the organs, therefore maintaining the vitality for extended periods of time. In fact, the latest advance is about normothermic. That is, you create an environment just like the human body, where there is human blood, like you know how we transfuse blood. The same blood type is pushing into the organs, moving into the organs, pumping into the organs constantly, and you're removing and checking the electrolytes and adding electrolytes which are deficient. So that can go on for 24 hours for many of the organs also. A heart can last for 12 to 20 hours, lung can last 12 to 20 hours. These advancements have already come in Europe and the US, and we are hopefully by a few next year or so, we should be able to adapt that into our country also.
yeah, because we have seen that some patient has died somewhere, and they are transporting the organ from that place to
Yes.
another city and for transplantation.
Currently in India, we have the ice cooler box system and we have the cold machine perfusion system.
Okay.
So it can extend up to a few hours more than what is standard.
Now, if the transplantation has occurred, now how that organ will settle in? How what is the time taken for the organ to settle in or start working well?
So the organs usually start working immediately, but for it to work fully to its full capacity, it can take anything between 6 to 8 days or a week to 10 days also. Sometimes some organs take a little longer time. That's when we call as a delayed graft function. Or sometimes it is slow graft function, which might need some intervention, some more medication, some dialysis, something like that. But majority of the organs start working. For example, liver starts producing bile immediately, the kidney starts making urine immediately, the heart starts pumping immediately. But for it to work to its full capacity, to help the human body, it might take about a week to 10 days.
Week to 10 days. And when do you find that this organ has rejected? I mean, only after death it is found, or it is like in between you also can understand that this organ is not working well and this transplantation has failed. So
Oh
you
yeah,
can remove and you can do another secondary transplant or something like that. Can it is
oh yeah, yeah, yeah. There
yeah.
are multiple trigger signs or the signals which we can come to know even during operation that if the perfusion is not good. So it's called hyperacute rejection. Thankfully for us and for the patients, it occurs really, really rarely, like 1 in 1 lakh patients. You see that
Oh,
once the organs, the blood flow is connected and blood is moving it, suddenly the organ doesn't pink up but becomes black and blue, or the patient's lactates start rising, the blood pressure starts dropping. So we come to this like a severe allergic anaphylactic reaction occurs. That's hyperacute. So
okay.
that used to occur like about I would say 20 years ago, very commonly. Nowadays, it rarely, rarely occurs. Early signs of rejection, like acute rejection, which occurs in the first 6 months, can be seen in first week or first 10 days or first month also. We educate our patients also. Like there are some signs like they feel fatigued and tired and a little bit of feverish. But before that also, once we do the test, we come to know it's going up and down. The creatinine is going up, the bilirubin is going up, the intestines lactates are slightly rising. So we come to know. So by doing regular tests, so sometimes patients might say कि कितने बार blood test करवाओगे अभी. So usually it is weekly for the first month, then twice a week for the second month, and then once a month for the first year, and twice a month for the second year, and then onwards. So therefore, the first 6 months one has to be very vigilant as doctors, as patients, all of us.
So how long you keep the patient for at your center? Like you are
So I'm on their hotline for lifelong, but
lifelong. Uh,
but but the frequency of visits and communication. So usually first month is very important. So most of the patients go home after within a week's time for majority of my abdominal organs, and once they go home, they have the ability to contact me 24/7 anytime, and I see them for the first week. I see them twice a week. Then I see them once a week, and then once in 15 days. And they do sometimes they'll be like, so as I told you, one of my patients is in Bihar, one is in Rajasthan, एक लुधियाना में है तो वो blood test करके भेजते
uh,
हैं. And
uh,
they might come to see me once in 3 months, once in 4 months. And then what I do most important is they should have one primary doctor they can visit, and then we have a connect. So
okay.
that doctor can also talk to me. He also knows my view of the transplantation and my perception and what I expect. The patient knows this primary doctor very well because he's been seeing him regularly. So we all three form a team. So if there's an emergency, he can talk to this doctor. The doctor can talk to me immediately, and we can treat the patient at the primary center quickly, and then get transferred here if there's any emergency.
Definitely. Very good.
और
Now,
ये प्रबंधन लाइफ टाइम का हो जाता
yeah,
है.
lifetime तक आपके patient है. But that is true. If patient is having a long life, I mean, they don't mind coming to you and saying hello to you. That is, I think, that will be a greatest gift they have got from you. So
No,
there's
I feel very happy, and it gives me more energy to practice. So
yeah, that is
yeah,
true. It is really a
that's
rewarding surgery. Yeah. So while discharging your patient, you have already said that there is a lot of lifestyle changes you have to do. What exact lifestyle changes they should have apart from infections that prevent infection? Anything else?
So I
Anything?
feel one is definitely transplant oriented. So transplant oriented would be practices which will be protective, practices which will be like defensive. So protective would be preventing infection. So not eating street
He
foods.
was playing before. Can he
Oh
play?
yes. Oh
Uh,
yes. Oh.
uh,
So transplant. I'll tell you about so my own personal experience. My own transplant patients are swimming. They are biking on the roads with their children. They are climbing mountains. They're traveling across. One of my patients is in UK. One is in Australia. So they're traveling. One patient, his job is marketing. So he
okay.
goes to Dubai, he goes to the remote places in Nasik and Solapur. He'll also go across to Delhi one day. If next week is Mumbai, then other week is out of the country. So they'll travel. They should not stop working. They should continue their own field. I had a patient who was a surgeon and he was a medical student and now he's becoming and he wanted to be a surgeon and he was like madam अभी तो मुझे फिर अभी ऐसा ढूंढना पड़ेगा रिसर्च में जाऊं ऐसा कुछ करूं I said no, you can fulfill your whatever vision is, and now he's into second year general surgery.
Okay.
So they can fulfill and be a part of whatever they want to be and have a good fulfilling family life, a good practice, good career. Why not? There's no limit.
So you are really removing myths which are mainly with transplantation, because mainly most of the time they feel that they cannot do all these things. Then secondly, few of the people, they feel that they cannot do organ donation because their body will get disfigured. So I mean, there will be some only one kidney they'll be having, or if some organ has been removed from their body, it is for the living donors, I am asking. So because we have to promote, we have to make awareness, because you already said that such a long waiting list is there for this. So I think we all should understand, and we should remove these myths from the general public, that organ donation is not wrong. I think we can do, and if it is required, it should be done.
Yes, I agree, and I really feel very passionately about it. I'll just tell you a story. I had a patient come to me last week who was in kidney failure, and she needed a kidney. So her son said, "मेरी अभी अभी शादी हुई है." So I said, "उससे क्या doesn't make a difference." So he
Yeah.
said, "नहीं नहीं, फिर we are planning for children." I said, "Yes, you can have children, and you're not going to be pregnant. So anyways, it's not going to impact on your physiology." So he said, नहीं नहीं मैडम अभी तो शादी अभी हुई है. So there are a lot of myths and misunderstanding.
Yeah.
And then his sister, whose daughter, she said she already had two children, but she said I'll have to ask permission कि मेरे in-laws फिर क्या कहेंगे कि
Yeah.
handicap हो गई है, इसके
Yeah.
आगे बच्चों का कैसा होगा. So these are all myths. I mean, a living example is my own uncle and aunt. My aunt gave it to my uncle, and both are still fighting like kids and living a healthy life. She has got 5 children. He has got 4 children, and
Okay.
they've all got like 8 grandchildren each. So one can live a fulfilling, happy life. Now, coming to the important point of scars, see, appearances are important. Why would a healthy person take the risk to his life or her life and then undergo big morbid surgery? So let's talk about that first. So one is surgery has become so advanced and skillful that one can do laparoscopic surgery, robotic surgery through minimal small scars, and let's say single port surgery, ताकि जहां आपका umbilicus है वहां पे just 2 inch incision लेके we have a multi-port single port. So that port, once it is put, it has got 3-4 entries inside it where one can mobilize the kidney, and through a small skin squeeze incision in the lower belly, one can remove the kidney. So there's hardly any scar there. This is small near the navel and just lower underneath the bikini scar that you say, lower down. So that scar is minimal. Safety margin has improved so much. Now, definitely when choosing a donor, just because somebody comes and says, I want to be a donor, we don't select that donor. We appreciate that they come forward, but they go through rigorous testing. Blood testing, organ testing, size matching, blood vascular, how is the vascular flow inside, how are the tubules arranged over there, to see whether they're really fit, and then again psychological assessment, and a multidisciplinary team assesses them to see whether this patient can really undergo the surgery, what are the risks after donation, will this person have a healthy life, are we harming this person, and is there any impact to the afterwards in the society for this patient? So is there any pressure on this patient? So after doing all this, then we say yes to the patient. There are multiple donors, we say no before we say yes to one. So therefore, people should not be afraid कि एक बार हाँ बोल दिया तो बस लेके उठाया और organ निकाल दिया. ऐसा तो नहीं होता.
Yes.
So second that, third is safety margin has improved so much that I would say about 1 in 1,000 that a person donor could have some kind of problem, surgical problems, which can impact prolongation. Risk of death is really low. I would say 0.0001%. It's an operation. So there is definitely a risk that one has to undergo, but the safety margin is much more. Therefore, I would ask and really plead if there is any family member in anyone's family who needs an organ with like kidney or a half liver, please come forward, because we have got excellent surgical expertise all across the country, not just in one place or one state, and who have got tertiary care hospitals and which can provide good transplant surgery options, and the patients can lead a better and healthy life and without having any dangers. So they'll explain to you properly. So please come forward and help each other.
Yeah, definitely. There's also an example in Bihar. Our previous Chief Minister of Bihar, Dr. Lalu Prasad ji, daughter gave kidney for him.
Yeah,
So,
living
and they both
example.
are living a healthy life. I mean, everything is fine with them. So I
Yes,
think we should take examples from such cases, and I think we should give life to such people who really are waiting just, and they die just because they don't get the transplant or organ on time. So
true, true.
that is again very important. Now, madam, I want to ask you one more question, which everybody thinks that there are few organs which are, you also said that there are few organs which are been accepted easily, but there are few which are rejected, like lungs, and lungs you have said in India, if they are not been done, intestine and all. Also, I don't know whether it is how successful it is, or it requires a real expertise to. Do you think that only because kidney transplantation we say feel that now it is becoming quite successful, but others still there is a lot of dilemmas in our general population. So what do you think that why some organs are accepted and other are rejected, and it is difficult to transplant?
So two things to that. Lung transplant, intestine transplants, pancreas transplants do occur in our country. The success rates is also much more acceptable. So for example, pancreas transplants have a success rate of about 98% survival for the first year and about 80% survival for 10 years. And so that is excellent survival. Secondly, intestinal survival is also about 90% for the first year and about 70% for 10 years. Lung transplant is also doing better now. Now, definitely there are very few surgeons who are doing these surgeries. Therefore, the number of surgeries are definitely less. When you see kidney transplant, which was occurring in 1980s, which started about in 1970s or 60s in our country, but 1980s there were very few centers who were doing it. So we are in that phase for lung, intestine, and pancreas. कि कम सेंटर्स है, कम सर्जन्स है, कम एक्सपर्टीज है, कम रेफरल्स भी है, बहुत कम लोगों को पता है कि अरे ये होता भी है, ये भी चांस है. Pancreas transplant can cure, like, the reason for diabetes is pancreas, कि आपके islet cells are not producing insulin, or there is resistance to your insulin. You put in a good healthy pancreas which produces insulin. You don't need blood sugar measurements. You don't need insulin. You can eat sweets as you and me do, and you can enjoy a fulfilling life. That is something उसके बारे में awareness बहुत कम है. Intestine transplant के लिए a father can donate a small part of the intestine, or a mother can donate a part of the intestine to the child who's in intestinal failure, and that again that awareness is less, expertise is less. उसके लिए कम होते हैं. But I think the success rate is really acceptable and is really good. So if there's anybody who needs it, please look out. We have good experts all across the country, though there are few.
It's a very important awareness which you have spread, because people are only thinking that only kidney can be transplanted. It is very, very important that there are so many organs which can be done.
Yes,
and now organ donation has become so, I mean, it has become in mass level, like we people have also taken that advocacy that we will donate our organs. So it's like that, it has to be. But one thing I want to ask you, that what is your success rate? Just, I mean, what do you think?
Which organ?
Any organ. Like you are doing multiple organ transplants. So what do you think? Which organ you feel hesitate that I think this will not be a very good surgery in this, or this will not be accepted, and this is 100% I can do everything normal for the patient. So
liver, kidney, pancreas, and intestine, they have transplantation surgeries has been there since 1940s. We're already in 2025. We'll be reaching 100 years very soon. But I would say that the success rate of kidney transplant is definitely higher because we do T-cell, B-cell cross-matching, living donation. The success rate of liver transplant is very good. See, kidney transplant के लिए, kidney failure के लिए dialysis है.
Yes.
Liver transplant के लिए there is no machine. Either you die or you live. So the success rate for you're talking about, I'll tell you about my success rate. So our success rate is about 97 to 98% for the first year. The 1 or 2% that we see fall off is either they succumb to alcohol, or they stop the rejection medications, or they have like a heart disease or something like that, something unrelated to transplant, and therefore the graft also then stops. So 97 to 98% success rate is there in liver transplant. In a kidney transplant, there is 96 to 98% survival success rate for the first year. And for the pancreas transplant, as I said, again, 97%. So, thus, in our country, expertise, surgical care, pre and post-op, tertiary care, infrastructure, we have everything. So now most important is the patient information, patient compliance, and bringing it all together, working as a team. That is all that matters. And finances to
Yeah,
provide the immunosuppression.
yeah, that is key. That is important. So, madam, what do you think about, what do you want to tell those people who want to do organ donation? How can they, someone can register themselves for organ donation?
Oh, registering is very easy. Registering is there's a QR code available on motu.gov website. That is you can just scan the QR code. You can put in your details. You can link your Aadhaar if you wish to. It just requires your name, your date of birth, and the organs that you want to donate. I feel, see, death is death. Once you are dead, there is no pain or there is no fear. There's nothing because the story is over. So after you die, what is the harm in donating the organs and let somebody else live? So if I can die and after me there are about 4 or 5 people alive and living and enjoying the life that I enjoyed, I would be so happy. My life's work would be like complete. So I think one should not be afraid. Death ke baad to kya? There is no fear, there is no pain. Just kind of, I think it is I feel it is a kind of our duty to our society to do that. So that is important. And secondly, for living donation, as I said, it is very safe surgery. One should be come forward and please help each other. I think we can reduce our mortality for organ failure. When I was studying, the reason I really went into transplant was because I couldn't.
Yeah, that was my next question to you.
So when I was like during my surgical training and my medical training, the wards would be filled with patients with jaundice hai, pani nikal rahe, coma mein hai patients and patients in end organ kidney failure, those who can't afford dialysis just waiting. One of my own junior colleagues, as a medical student, died of renal failure. I feel a time, a stage has come when we have organ transplant here. So my reason was, why can't there be a treatment where we can help patients survive? So we can help lead them. I mean, when transplant is available, why can't we have it in our country? So that was my first goal. Therefore, I went into like, what is transplant? How does it work? And that's the reason I went into it. So when that option is available, not even 100 kilometers away from your place, why not take that chance? Why not come forward for organ donation and help someone?
Yeah, definitely. So that was the reason why you became an transplant surgeon.
Yes, it was very disturbing. I used to be very
I mean, this
restless.
is a very, very difficult or very demanding, or what do you say? It's really sometimes rewarding and sometimes very depressing also. So it is a very, although all branches are like that. We all
Yes,
face life and death in our this thing. But I think this is a very difficult branch. But what inspired you? Just like that, you became a organ transplant surgeon, or it was something else which made you organ
So
transplant?
as I said, I was very curious, very restless. I really wanted, how can people just die like that, just waiting to die in an organ failure, just coming to the hospital, just waiting to die. I feel there's so much yet. I feel that even patients with advanced cancer should have something with transplant where we can put in a new organ and their cancer goes away.
Because these are the two things, cancer and failure.
Correct.
I think they go side by side, and I mean,
Absolutely.
life, it is very
And thankfully, the reason that I would see my patients with liver cancer, now we have liver transplant for liver cancer. I've recently done transplants for my liver cancer patients and they are doing well and we're just monitoring them. So that itself is a good thing. So that was one reason why I went into transplant. But when I went into it, I am so happy. It is a very unique branch and I feel privileged to be here because I see death and I see life.
Yes.
So I see the reality of life completely in front of me. It's like day in and day out. मैं भूल ही नहीं सकती.
So it has shaped your view about the mortality, I think.
Yes, I think I have learned to accept. I don't fear it. I've learned to accept it. I've seen it close
Definitely.
100 number of times, but I feel that one should live life fiercely. Really happily enjoy, and one should learn to show your appreciation and love. I think that is where we really lack. Our life whatever life we have got, whether it's short, medium, or long, we don't know. But we spend half of it just overthinking, I feel. I
Yeah.
think transplant patients who get the organs should be more showing their appreciation towards the donor families. We, whom we care about, should show our appreciation and care and love to each other. Because
Yes.
time is really, I mean, you never know what time is there, what life awaits us.
Yes.
So I feel that I've learned so many things. Every transplant, every death teaches me a lot. So I've learned to be humble. I've learned to appreciate life more, and I've learned to be like
Accept
not to
the way
react
it is.
strongly more.
Yeah, that is true. So, what message you want to give to the aspiring doctors here who really want to be organ transplant surgeons?
So
First,
I
for the doctors, I want to ask what message you can give to them.
So, young doctors, I would say that choose your profession wisely. Don't choose it because it is convenient and comfortable for my spouse, convenient and comfortable to my locality, convenient because of financial things. The moment you choose what you like, and if you don't know what you like, try to do kind of an apprenticeship or internship in those branches and then see what you like. But once you choose what you like, delve into it passionately, work hard. When I say work hard, it's not about like, having information. Nowadays, there's so much of information available with AI and at your fingertips on your mobile, which is excellent. I didn't have that. I wish I had that. I would have been a better doctor, I feel. But your patient are your best teachers. So listen to them, examine them, talk to them. I think very few young doctors or even senior doctors do that. So your patients are your best, information. It's when you talk to the patients more, touch them more, examine them more, that you'll be able to treat them better. So that would be my message to the young doctors. I hardly see anybody auscultating them or, listening to
Yeah,
them.
now it is becoming
Examine,
little.
yeah.
I mean, it is with the machine made. Everything is machine.
Yeah, first they tell me about the CT scan. मैम स्कैन में ये आया है,
Uh,
USG में आया है, लैब
yeah,
में ये आया है.
yeah.
So I think the patient tells you everything.
Yeah, and touch is very important. If you touch your
Absolutely.
patient, yeah, that gives confidence to the patient, and for us also, it is very important.
Yes, absolutely.
Now, some message for our viewers who are joined today about the organ donation. I want to promote that organ donation is good and it should be done. So, what do you think? What message you can give as a organ transplant surgeon?
It is my heartfelt appeal, sincerely from my heart, that the moment we finish our podcast, if I have to give only one single message, I would say, pick up your pen or your put your fingers on your keypad, look up noto.gov, sign up for organ donation. Remember, in India, even if you sign up for organ donation and even if you have card with you, that doesn't mean your organs will be donated after you die. But second point is have a conversation with your family. Tell them that you would like to donate your organs. Family consent is very important in our country. Don't be afraid to donate your organs. If anybody in your family, extended family needs an organ, please come forward and be willing to be a volunteer. You can lead an absolutely healthy life. No doctor would compromise your life for the sake of a recipient. So please come forward. There are too many patients who die, too many. My message was only about organ donation. Be an organ donor.
Uh,
I think if you can do that, you'll be helping your own loved one at some point. So that somebody can even may come forward for you if you spread the message, if you need it at any point.
Definitely, Dr. Vrushali. Organ donation transforms tragedy into hope. Consider becoming a donor, and you might save not only just one life, but many, and your legacy can shine onto the others. That is what I can say this. And thank you so much. Now we conclude our this podcast, which was very enriching podcast on organ donation and transplantation. And I truly feel privileged and wish to thank our esteemed guest, Dr. Vrushali Patil, for enlightening us about the technicalities, challenges, and social acceptability of organ transplantation. You have shared invaluable insight on this crucial topic, which I'm sure will be extremely helpful for our viewers, especially for those who lose all hope about learning that their vital organs have failed. So, there has been significant advancement in the field of science and medicine, but what is equally important is that creating awareness among our patients that who need donors. And it is always encouraging a progressive mindset among people who can choose to become organ donor. So that is my message, that do not hesitate to donate, be an organ donor, and help and save lives. So once again, I sincerely thank Dr. Vishali Patil for sparing her precious time to be with us. And I thank all our viewers for watching this important podcast today. And I also wish to express my gratitude to our President Fogsi, Dr. Sunita Tandulwadkar, Madam, for providing this wonderful platform that fosters meaningful academic discussions. And it is through such initiatives that we could continue to raise the bar and stay updated with the latest developments. So until we meet next, let's keep learning, growing, working together to a healthier tomorrow. Stay hopeful, stay informed, and take care. Goodbye and good night. And thank you so much.
Thank you, ma'am. Absolute pleasure. Thank you.